to Let's Talk Health. My name is Ramata.
And I'm Dennis.
Today's topic of discussion will be about menstrual irregularities. To start off, menses, as we all know, is the regular monthly bleeding from the reproductive tract of women, usually in their reproductive ages in Ghana between the ages of 15 to 49. It may occur in early ages these days. As we've seen, it's occurring in children about 8 years, 10 years, 11 years.
Exactly, even occurs earlier. I mean, some children 10 years, even 9 years have been reported. Yes.
And some of the common symptoms associated with menses will be that they have mood swings, they have abdominal pain, they have soreness in their breast, they have bloating, usually complain of bloating.
So, as you can see, typical for most women, and I'm sure the women will testify, the menses usually is for 28 days to 30 days, some of them. However, the normal period is between 21 and 35 days. That's normal. However, for some women too, they sort of get some few irregularities. Let's say about 14%, right?
Yeah.
Can get some few.
Some say 9 to 14%.
9 to 14% irregularity. So it's not every type of bleeding which is irregular, which is, we will say, is abnormal.
Yes.
Some irregularities are normal for a few women. That is between the 9 and 14.
Yes. And then with some of the menstrual irregularities, there are lots of them. We're just going to talk about or touch on the common ones we have. One being absent menses, where someone or a young lady has not seen her menses even after the age of 16. Or someone who has been having her menses but then has not seen her menses for the past 3 months, but she is not pregnant. Another form is when they have their prolonged menses, where they have their bleeding usually more than 5 to 7 days. Some have their bleeding for 3 days, some have for 5, some have for 7. But usually when it prolongs beyond 7 days, let's say 8 to 10 days, then we consider it to be a prolonged menstrual cycle. A third one would be a heavy menstrual cycle, where they use about 3 or more sanitary pads.
That's what we call the polymenorrhea, typically in the medical fact. Menorrhagia.
It's usually called menorrhagia.
Exactly, because they bleed a lot, like you're saying. They use about 3 pads. A lot of the women soaked. They feel very uncomfortable, and some even cannot go to work, and it affects or whatever they are doing in the whole day.
Yeah, it usually affects their day-to-day activities. Another one too would be the painful menses, which I think is common amongst everybody.
Exactly.
And usually the biggest concern about women when it comes to the menstrual period, they usually have very severe abdominal pain, back pain.
And inhibits sexual activity as well. You know how the men always complain. And then painful menses.
I agree.
A lot of excuses the women give about menses and why
some
they don't
also
have
complain.
sex.
They usually have vomiting. They usually have diarrhea during this time, and it makes it a bit tough for them as well. So then we're going to talk about the causes, some of the causes that usually lead to some of these problems, Dr. Ado.
Sure. So typically we have what we call medical causes and maybe non-medical. Probably touching on the medical causes a little bit. I think the number one problem that we've seen is stress. You know, most of us are stressed. There's no one who is not stressed. We are all living in the cities. There's so much traffic. There's so much congestion. There's a lot of stress, and we are work demands and everything, and this causes a lot of problems as well. And aside the stress, probably it's a far-fetched, but people say people do vigorous exercises may be exposed to some of these irregular menses. Again, drugs as well. I mean, certain contraceptive pills may induce some people. Take excessive doses of these contraceptive pills, or they react to these contraceptive pills, and it may cause a lot of bleeding. There are a few devices that are IUD that also for contraception that may cause some few irregular bleeding and menses as well.
But we are not saying it's bad. We're just saying it can lead to some of these menstrual irregularities.
Exactly.
And there's a solution to that. You either just get another form of contraception that would work better for your body.
Yeah.
There are other causes, which are usually gynecological causes, and these are causes from the reproductive tract per se. It may be as a result of what people commonly know as fibroids. It can be as a result of infections in the reproductive tract.
Do you want to touch on fibroid a little bit, because it's the most common in Africa and in Ghana? Most black women get fibroids, right?
With the fibroids, it usually causes the heavy menstrual bleeding as well as the painful menses as well. So those are the two main problems it causes when it comes to menstrual irregularities.
Sure.
But then there are other causes. It may also be due to cancers in the reproductive tract, like cancer of your ovary, cancer of your endometrium, cancer, as we mentioned, cervical cancer in our first video we did with Let's Talk Health.
It's a big corporate when it comes to irregular bleedings.
So with the causes, it's a list of several things that usually lead to these things. But then in diagnosing it, we all know history from the patient.
So typically, when you come to see your doctor, I would want to take a history to find out whether you've had these problems. When you typically menstruated is very important to us because it gives a clue about some of these problems.
Yes.
Then we'll go on to do some few examinations. Typically, we may do a scan to check the reproductive tract, that everything is fine.
Yes.
And then after a scan, we may do a few labs to check. So definitely there's help, and these things can be diagnosed.
And with the abdominal pelvic scan, usually it picks up common causes like the fibroids we mentioned. But then if we realize that you need extensive investigations or a more specialized form of scan, we go ahead and we do it. But basically we start with the scan. And then depending on whatever the cause may be, there's always a treatment for it. Like the fibroids, we usually advise surgeries for most of our patients. If it is a result of contraceptive pills, like I said earlier, you can stop them, you can find another form of contraception, and it would help. Do you want to tell them about how to manage painful menses?
Exactly. So typically you would want to get to your nearest clinic and then see your doctor, or maybe even a pharmacy to get a painkiller to start with. And if the menses, normally it comes with pain, right? If the menses still, I mean, most women also use pads. They put pads in their bags. Heating pads, yeah. That thanks for the correction. To put in their bags so that it could sort of compress and stop the bleeding. But if it persists, you must definitely get to the clinic and see a doctor.
And with the pain medications, always pick the one that works best for you. Some people say paracetamol works best. That's fine. Some say diclofenac works best. That's fine. Yes. So whichever one works best for you. So like we said, menstrual irregularities is nothing so out of the ordinary. Once you've listened to this video and you think it applies to you, try and seek medical attention as soon as possible. And that brings us to the end of it.
So folks, we'll end it here. Thank you for listening. I'm Dennis.
I am Ramata.
Bye.
Bye-bye.